This is Dr. Corey Maas on Looking Your Best, and today I wanted to talk a little bit about the anatomy of fine lines, which sounds interesting because we think about the little wrinkles around our eyes, the radial lines around the mouth, and other areas of our face, and wonder, well, what's the difference between a fine line and some of the other lines that are on our face, like the fold between the nose and the lip? And there are very distinct differences, and what's important to us as surgeons and physicians is how we treat them. These things are the result of two things, major factors that really result in all of the changes to our face. One is just the genetics of aging. Gravity and has a big impact on that, of course, but the elasticity of the skin also has a big impact, and that's genetically really predetermined for most people. But also there are extrinsic aging changes that we consider very important, things like sun exposure and smoking, which decreases the oxygen carrying capacity and the repair mechanisms of our body. And so there are intrinsic and extrinsic factors. And again, some of those extrinsic factors are things we can really control with using sunscreen, proper skincare measures, good exercise and diet programs. And those things really improve our longevity, the quality and appearance of our skin, and include things that are very important. I consider skincare as important as brushing your teeth. You should be doing one thing twice a day. At least, and really that's probably enough for most patients in terms of maintaining the quality of skin. Now, getting to those distinctions we talked about, if we look at the anatomy of a fine line in the surface of the skin, these small changes are the result of, as I mentioned before, at least in part gravitational changes, and that's where the skin loses its elasticity, or it doesn't sort of rebound to what it used to be. For example, when we smile, we'll often get little lines around the sides of our face, or little vertical lines, vertical and horizontal lines at the corners of our eyes. And when we relax the smile in our youth, those lines completely disappear. With sun damage and aging, those lines are there even at rest. And amongst the treatments that we talk about for those types of indications are things like the botulinum toxins, Botox, Dysport, and Xeomin in the US, and soon there'll be a few more, and other fillers, which specifically I want to get to today because there's important modifications that we have to make to be able to effectively treat fine lines with cosmetic filler injections. So as we get into this, we've learned over many years of using in fillers. In fact, the first approved filler was a product called, the original one was called Zyderm, and it was made from bovine or cow collagen from a closed herd, and it was the first and only filler company really for almost 2 decades. Collagen was interesting because it had to be injected into the dermis, that means into the skin itself. It couldn't be injected below where it went away very quickly. But what we learned from that was a very important lesson that carries on today, and that is the treatment of fine lines, like the little radial lines around the lip, the corners of the mouth, the cheek area, lines that are there at rest, not just when we're making facial expression, really requires that we as surgeons or physicians are injecting intradermally. And that means in the skin itself. Now there are strategies that I've seen out there wherein, for example, with the lips, they're putting a needle in and going underneath the lip and puffing the entire lip up. In other words, sort of ballooning the skin up. They're below the skin, not in the skin. And by stretching the skin or creating a lot of edema and swelling there with the filler, they're able to effectively lessen those fine lines. But that really changes the anatomy of our face, making the lip puffy, sort of simian looking, almost like a monkey lip, if you will. And not an attractive appearance. I see this all too frequently now with this strategy of injecting below the skin. So the fine lines treatments, which I've described in a number of other discussions, and certainly there are videos that you can watch beyond the ones we're showing today that we've created about this, include modifying some of the current fillers because they're all too thick as they're currently given to us or distributed. collagen as a product went away probably a decade or more ago. And so we're left with these HA fillers. The small particle granular fillers are not good for fine lines because we can't get them intradermally, nor would we want to because they would be bumpy or lumpy. Fat transfer, which can improve quality of skin, is not a very good product specifically for fine lines because it can't be placed intradermally in the skin. So the goal really in doing this is finding one of the HA products, and I particularly like Belotero or Restylane Silk. Belotero because it has the least amount of this side effect known as Tyndall Effect, which I've talked about before, where the skin gets a little bit blue. It's just a reflection of light. It's not really a bruise. But these gels, when they're really concentrated, are able to reflect light, and it reflects it in the higher energy or shorter wavelengths, which happen to be the blue wavelengths of light. It also is very hard to get these thick gels, if you will, through a very tiny needle, which is required when treating fine lines. So the fine lines treatment, if we're talking about office-based procedures, are pretty much limited to using one of the botulinum toxins, Dysport, Botox, Xeomin, or doing a modification so that these gels, the HA fillers, are not so thick and can be injected intradermally. In fact, we just completed a split lip study looking at the two that I find most beneficial. That's Belotero and Restylane Silk. And I could probably add into that Vobella, which is a newer product from Allergan, although it still has to be a little less concentrated. What we've learned in our studies is about 10 milligrams or less per deciliter. 10 milligrams per deciliter is the cutoff where no Tyndall effect occurs. And we do serial point injections, tracing each of these little lines out and really lifting that little crack in the dermocept that we've talked about. And I've got figurative examples, sort of graphics, showing the principle of how that works. And finally, when we're talking about fine lines, I can't leave out, because those are office-based treatments, that the ultimate treatment for these is some type of laser skin, some type of resurfacing. I did a little forecasting there. When you do skin resurfacing, original resurfacing was with sanding or dermabrasion, where you really abraded the skin, just like you followed skin your knee, only it's a much more controlled abrasion, down to the second layer of the skin, the dermis, and into the papillary, not really so much reticular layer of the dermis. So the middle of the second layer of skin. But with the dermabrasion or sanding technique, as well as deep chemical peels, we're treating the entire surface area of skin. And now we're using more laser skin resurfacing, and more specifically fractional laser resurfacing, because we're able to condense the recovery time to less than a week, the acute phase of recovery, and improve outcomes. That means better or improvement of these lines without long recoveries. So I wanted to spend a few minutes helping define what fine lines are, talk a little bit or give you a little introduction to the treatment options for fine lines, and we can get into a little more detail as we move forward. But that's a summary. There's really the injectable cosmetic fillers, the botulinum toxins, laser skin resurfacing, and probably ultrasound I'd have to include too as a newer treatment, and radio frequency for some benefit with these lines, although those may not be as long lasting as resurfacing. If you have any questions about fine lines specifically, please don't hesitate to write drmaas.com. As always, we welcome photos and videos, and I'm happy to answer your questions. This is Dr. Corey Maas on Looking Your Best.